Hi, GP learners, and thank you for joining us for this, our Wednesday webinar. And in this session, I'm going to be joined by a group called Klinik Healthcare, who have been providing online consultations to many of you already out there and are able to do quite a lot of fancy things. And in order to help understand their platform, I thought it'd be useful to have them come and show what they can do. So I'd like to welcome Christian, who's from Klinik Healthcare, onto the stream, and you can hopefully all see him just there at the moment. How are we doing, Christian?
Hi, good. Hello. Gandalf. Thank you.
Hi. So just to remind everybody, this is a live session. So if you're joining us live, feel free to comment in the comments and stuff. Feel free to say hi, where you're from, all that kind of stuff, and whether you're already using Klinik or whether you're interested in using Klinik as it is. Christian's got one of his colleagues, Ben, that's going to be joining the chat and helping to answer questions as we go through. But effectively for this session, what we're going to do is go through a demonstration of the platform, and then we're going to come to some questions that many of you have already submitted for Christian to answer. And then at the end, we'll give you the opportunity to ask your own questions as well. So do hold those until Christian's finished his demonstration, because I'm sure many of those will probably be answered. This is a similar format to the sessions we've run previously, which hopefully some of you have seen before, and that was our Digital First Providers Guide, where Klinik Healthcare also joined us with a few other providers. And if you're interested in that, we have got another session coming up on the 9th of September, which will be doing a few other providers as well. So feel free to join us for those. But anyway, well, let's get started. So I'm going to hand over to Christian so that he can share with us what effectively Klinik Healthcare does. And to do that, I'm going to pop his screen on things. So now we can see his screen and things. And away to you, Christian.
Do you see my screen now?
Yeah, we can see it nice and clear.
Okay, great. Yeah, so the title slide pretty much summarizes what we want to help a practice with, is which to ensure they see the right patient at the right time and ensure they can efficiently redirect patients in other relevant pathways if they do not need to see the GP. A little bit about ourselves. We would consider ourselves as an online consultation and demand management system established in 2013 in Finland by a core team of doctors and engineers with leading expertise on how patient pathways should be arranged in order to deliver high quality care and cost-effective processes. 2 of the 6 founders also have computer science qualifications, who combined their medical expertise and computer science knowledge to build our algorithm. We also have a team of engineers and user experience designers, as we see user experience design really as key to our success. As for the patient and GP to use the system, it must be intuitive and user-friendly. With that said, we currently have a product that has been adopted in 450, well, it's actually more now, healthcare centers in Finland and in the UK, and we cover about 2 million people that have access to our product. In the UK specifically, it's around 500,000 users by now. We've been implemented in single-sited GP practices, multi-sited GP practices, PCNs, and recently also a federation. So this is our take on a general GP practice setting without an intelligent patient flow management solution. So patients on the left-hand side with a variety of dispositions either call the practice or submit an inquiry via an online form, creating long queues on phone lines or in online systems without providing insights into urgency or need. Furthermore, there is no system in place to order incoming inquiries or efficiently redirect them within the practice. And the outcomes can be that it creates an unavoidable shortage of GP appointments, and there's no consistent collection of data and potentially creates poor patient experience, which could drive them to other areas of care like secondary care. So with the implementation of Klinik, our goal is that we want to put you in control of your patient flow. So the 4 key elements of our solution that we provide is an intuitive total triage platform handling clinical and non-clinical inquiries coming through online, telephone, or via walk-ins. So all these can be taken through the same system. We then provide a clinical medical AI engine, which automatically recognizes over 1,000 symptoms and conditions. It can identify a primary health issue and recognizes its urgency. And now with that information, the staff can use our patient flow management system to efficiently collaborate and redirect patients prior to them even seeing a GP is necessary. In 4th place, which is not shown on this slide, but we also provide dashboards, which presents all inbound data from frequent users to information about prevalence. It also helps you to deal with admin inquiries much more efficiently, and to highlight, it identifies inquiries that are suitable for self-care, leaving the GP with a smaller volume of patients. And please notice that the urgency indications is only visible for the practice staff, but currently we are monitoring the suggestions for self-care and are developing a module that will provide this suggestion of self-care to the patient directly without a practice staff having to be involved, which would further reduce the pressure on your practice. The planning is that this module will be launched before the end of this year. Before I show you the demo, I just wanted to briefly share with you why our current customers tell us they choose to work with us. The 4 main drivers they tell is the user experience is important, because it helps staff focus on who need care first, which results in a significant reduction in administrative time. Secondly, it helps to redefine and reform how the patient flow is managed. Thirdly, the dashboard is appreciated as it gives the whole practice team visibility of the flow and type of demand. And finally, some will also tell us about the value that is created because of the time clinics team system help saving. If I now zoom in on Klinik Access, which is the patient online consultation module, we provide a banner and a pop-up, which will be on your practice website. And via that, the patient will arrive to a screen that will inform the patient when they can expect a same-day response, or after which hour they will receive a response the next day. I'm stressing a response because we do not promise an appointment. We want to be you in control of whether or not a patient needs an appointment, and you can make that decision with the information coming through our system. We provide then also for some of our customers a button here that can lead them to an online registration form in case the patient is not a registered patient. But if they are and they continue, they arrive to the tiles page, which is the first step for the practice to direct the patients to the most optimal resource in primary care. So all these tiles will be linked in the backend to the units in a practice that you want the different queries to be routed to. Please note that the text and the number of tiles is customizable and will be determined by you during the setup of the system. And the patient would select one of these tiles depending on the nature of their visit. Only the appointment request query will take the patient through our medical algorithm. Well, for the other queries, like admin queries, a short form is linked to the tile, and you can add questions that ensure you will receive the information you need. And next to questions, we can also provide a link here if you want to link them, for example, to patient access, for example, for a repeat medication request. Behind every tile, COVID-19 is considered, and before the patient can submit, they are asked 3 standard questions focused on COVID-19. We have also added a dedicated COVID-19 tile, which would take them through a set of questions that result in 3 types of recommendations, which is low, medium, and high risk. High risk, and in case of high risk, they are advised to contact A&E, but otherwise to monitor their condition. In case they choose an appointment request, they will be taken through the medical algorithm. So this is the front page that they would see. We ask the patient to select the location of the symptom. This can either be on a touch screen, they can touch the location, or they can click the location using the mouse. Our system works on any device. It's device agnostic. It's not an app, but when it's on a mobile phone, it looks and functions like an app. By selecting a location and providing their gender and duration of the symptoms, the patient provides the base knowledge that our algorithm then bases its next questions on. So in the next section, we use a dynamic symptom cloud. Please note, we don't use questions which can lead you into a narrow diagnostic path. The AI algorithm comes with a selection of primary symptoms, general symptoms, and symptoms in different locations to try to narrow down what the potential condition could be, but also what the urgency is. So here we make use of 3 symptom clouds. The first and the second symptom clouds are used to ensure the symptom taking is complete. With this third symptom cloud is to determine the urgency. And when the different symptoms are selected, in the background, the algorithm is working to understand the probabilities. It's designed to think like a medical doctor. So every time you put something new in the system, it goes back and calculates the probability based on the whole plus the new input. Then the system also asked for some open text information for the symptoms a patient has clicked on. So yeah, that's dynamic and is changed with the input from the previous section. So patients can't move on unless they put some information here. Feedback from many of our customers is that they see this as a very valuable part of the information provided by our system. And they feel they get a lot more information here than in a 10-minute GP appointment. The reason being for that is that the patient takes their time and they might be more open than they would be when talking to a GP. For the last part of the feedback on medical inquiry, we ask for information about previous treatments or medication the patient uses. To further help your practice process incoming inquiries more efficiently, we provide a module that allows the patient to provide feedback on which times would not be suitable for them to book an appointment. This information allows your reception team to book an appointment proactively if deemed necessary. This is an optional module, so you can also switch it off, but many of our customers use it. Finally, the system asks for contact information, and we ask how the patient wants to be contacted. The telephone number here that is provided is used in the practice interface to be able to use our secure messaging system to communicate with the patient. We are working on the integration with the NHS app, which, if used, would populate these fields automatically, which should become available after the summer. Again, here at the bottom, the patient is informed when they can expect a response from your practice to help manage their expectations. On the right-hand side, you can see the patient can see a summary of what they've selected and what they've filled in, and if anything is incomplete or incorrect, they can now still go back and adjust before submitting. When submitting their request, we ask for some feedback. As we are very focused on user experience, we want to ensure we can constantly learn how to improve the system. And based on more than 60,000 forms of feedback, over 88 to 90% felt that the services are either excellent or good. And an important insight is that it doesn't seem overly age-specific, which is encouraging to see that all age groups can use the system. Finally, I want to show the emergency message, which will be shown in case the algorithm concludes it could be an emergency, which can cut in any time during practice hours. If the patient gets this message and they didn't think that they required emergency attention, they can still continue to submit, which is a feature that is appreciated by most of our customers, as many alternative solutions don't allow for this. And the reason is that as the algorithm needs to keep a safety margin in consideration, the patient can at least judge themselves still if they need to continue to A&E, and this then prevents people from going unnecessarily to secondary care. As you would not want cases with emergency indications to come through when you cannot follow up, the safety net is that when the practice shuts, patients no longer see this continue button. So that's the patient pathway. Next, I'll continue to the practice interface, which is the module where we provide a system for your practice to structure incoming inquiries and set up efficient processes to redirect patients into the optimal pathway. So this is the login for users to the practice interface. As our service is cloud-based, people can remotely log in as well. And this is then the practice interface, which is available to everyone in the practice, but you can set up user rights in any way you want to use it. To give you a bit of orientation about this screen, this is the morning view showing some statistics on the right-hand side. On the left-hand side are the cases that have come through over a fixed period of time. And we've included icons here to draw your attention to things that need your attention. Most importantly, the orange dots are the urgent cases, and red triangles are the emergency cases. So when we set up the system, it will be done with you and in line with your practice processes, and as such, it will support your way of working, but the power of the system and the potential to create value is largely dependent on how you organize how the incoming inquiries will be processed. So the incoming inquiries from the tiles are directed to the units that you have defined to ensure the workload can be split efficiently. I mean, this is not the best slide because it shows now that everything is linked to a duty team, but clearly you can set up the different teams that you want. And as you see, these subject headings are the tiles that you saw previously in the patient pathway. To support the teams to be able to focus on the inquiries relevant to them, you can use this filter to see, so they will only see the inquiries coming through the specific tile that was linked to their unit. And using the urgency filter to further optimize the time spent by GPs on incoming inquiries. Some of our customers have chosen to use this urgency indication coming from our medical algorithm to allocate inquiries that are deemed not urgent cases or appropriate for self-care to an upskilled nurse team for assessment, while only urgent and emergency cases are assessed and triaged by the GP. If I now go into an actual case, for example, I select this urgent case, please notice that when you open a case, the system won't allow anyone to work on it at the same time. The report on the right-hand side is in the same format, whether it's a clinical inquiry or an administrative inquiry, so you get used to it. So in this report, the person assessing this case can find the symptoms selected by the patient with additional comments here at the bottom of my screen. And if you scroll down, I switch between slides here, but in the system you will scroll down. There are the system recommendation in terms of appointment urgency and some differential diagnosis, all of which can be used then by the staff assessing this case to determine what to do. So in respect to this specific case, the reason why the system indicates it might be urgent is because the patient indicated he had a fever for 3 days. So with this information, you can set up efficient procedures to either take action to book an appointment, contact the patient to get more information, or if the information provided supports it, to redirect the patient to another resource in primary care, like a physiotherapist or clinical pharmacist, and should you have set up these units in your system. If the person assessing this case would like to contact the patient for additional information, we also have a direct messaging system which uses the telephone number the patient provided. To open this functionality, you need to select this Send Message button, which would open this window in your screen via which you can contact the patient. This is a two-way messaging system, so the patient can respond, and you can continue to work on your case, as in your screen this purple dot will light up to indicate that you have a new message. If, based on the information provided, you decide that this either the case would need an appointment, or maybe you want to redirect it to another resource in primary care, you can use this Select to Direct to Another Unit button, and then which opens this open text field where you can, which you can use then to fill in some instructions for the person that you are redirecting this case to. When submitted, it provides in the patient record a summary of the information that you put in the text box. And then on the left-hand side, it will show up in the reception workflow with an arrow in front of it indicating it was redirected by another unit. So in this case, it now pops up in the reception workflow. To integrate this information into your patient record system, we are currently working on an automated integration with EMIS and System 1, which should be launched later this year. So for the moment, we have provided for an efficient process using a copy button, which you can see here. If you select the copy button, you can simply paste the patient's record in your central system. So there's no downloading in between the two systems, and you can edit the record after pasting the information. Another thing to mention is that with the automated integration into EMIS and System 1, once we have established this, the two-way messages with your patient will also automatically be integrated into our system, into the central patient system. With the same timing that the automated integration with EMIS and System 1 will go live, we will also launch another function, which is that it will allow the doctor to ask the patient to upload a file or a picture with their medical inquiry. Then lastly, this is the last step in the practice interface. We ask for your professional opinion whether you agreed with the urgency indication that the algorithm came with. This is because the algorithm is not based on machine learning, but it's clinically supervised. So we use this feedback loop to review any deviations, and which is then used to improve the working of the medical algorithm. And so it's monitored constantly by a medical team, which then uses this feedback loop. In order to provide your practice to be in line with NHS requirement of total triage, we provide a module that allows your reception team or other remote workers to take the patient through the same triage path. So how does it work? The receptionist or either someone remote, like a nurse in a care home, can use the tool to take an incoming inquiry through our system using a dedicated module, ensuring a consistent data collection and the possibility to take 100% of medical inquiries through the same AI algorithm. It is very similar to the patient interface. So when, let's say, your reception receives a call for an appointment request, they would select the appointment request tile and take them through our algorithm. But they could also use it for non-medical inquiries. If they have taken the patient through the AI algorithm, they end up with a summary of the case based on which they can decide where to direct the inquiry. So they can choose to make an appointment if it is an urgent case, or they can submit it to a duty team who then have a lot more information than they might have prior to this. Once they submit the inquiry, it will show up in the professional user interface with a flag in front of it, indicating it has come in via the Klinik Connect tool. Now I will introduce the functionality of the dashboard. This enables you to view consultations in real time and far into history. It provides you with key insights on what consumes most time and which symptoms have prevalence. The main summary view shows the status of the practice daily important figures. The menu on the left allows for further slicing and dicing of the information on any level you want. The dashboard always opens to the current day view, but you can change the date range. If you want to analyze the performance of a specific unit, you can select only the units you want to analyze. In the medical section, you will find for the selected period information on the amount of diagnosis per diagnosis type and the totals per condition for which the requests were made. In the user section, you will find information about the user gender, age, their home municipality, and their feedback on customer satisfaction. Finally, a bit of information about our support structure. So to set up for the system for you, we follow a 10 to 15 working day timeline during which we schedule 3 calls. First of all, a kickoff meeting during which we will go through all system elements that are customizable, so the environment will really fit in with your current workflow. Following, we have a super user training and a standard user training to ensure everybody in your practice is familiar with the system. After these training sessions, a demo environment will be made available for you to practice, train, and do a role play. And finally, we agree with you a go live date. And then to support a successful rollout, we can provide various marketing material to inform patients about the new service and how it works. Then to continue to support you as a practice after the implementation date, we have a support structure. So first of all, customer success manager will be allocated, assigned to your practice, who will have periodical reviews with you to take feedback on things that go well or the things that don't go well, and so you can also influence our product roadmap with any suggestions. In respect to more day-to-day questions for the patients and any professional healthcare professionals, the first line support will be the super user. And in case of an emergency, the super user can contact the customer success manager. And for non-urgent issues, we have a second and third line support via email. And with that, I thank you for your attention, and I can take questions.
Awesome. Thank you for that, Christian. And I know when I've seen this platform before, there's several parts of it that I found really useful. I think the body map is definitely one that I like quite a lot in terms of navigating the patients, in terms of where the particular problems are. I guess that does raise the challenge of when patients present with multiple problems. Have you any details in terms of how practice have overcome that? Say, for example, if they're complaining of problem head and tummy, yeah, that can obviously prove a challenge sometimes, can't it?
I think probably Ben could provide, my colleague provide via the chat that in more detail. I would say that the general feedback is that it's not, let's say, an issue that they think that patients have a problem that they can't provide feedback on several elements at the same time. The system works that you focus on one main symptom, but in the symptom cloud you can clearly select several other symptoms, and so I think the symptom cloud really provides the dynamic and flexibility to do select a broader range of symptoms.
Cool. Okay. So I know the other part of this session that we wanted to cover is that we've had lots of questions about the platform itself, and that we wanted to kind of cover those. I know some of those you have covered in the demonstration already, but I did want to share some of the ones that we've had on screen as well. So we had a question from EAKenB1, and this was talking about, I guess, the level of integration. I guess, you know, it'd be nice to just clarify it. So which clinical systems does Klinik integrate with, and also how deeply does that integration go?
Yeah, so what I showed you is basically the type of integration that we provide. So at the moment, the integration of our system with EMIS and System 1 is via the copy function, whereby you can copy the reports from our system into the patient's history, and you can edit it. Later this year, this will be via let's say an automated integration, whereby this complete report will be copied into EMIS and System 1 together with the two-way communication that is done via our text service.
Okay. And is there any plans to extend this to Vision or Microtest as other systems that obviously are used in the UK?
Not at this point in time. We clearly monitor the feedback from our customers, but at the moment it's not, let's say, in the foreseeable future that we have planned for this.
Okay. Another question we had was asking, obviously Klinik is in effect an online consultation platform. I guess the question we've also had, are you planning at some point in the future also integrating telephone and video consultations within the platform?
Well, so we provide already the, let's say, telephone option, as we have next to the patient pathway. We provide a separate module for the care navigation team, who can take a phone call and then use that separate module to take the incoming phone call through the same system. So that we do provide at the moment. Video consultation, yes. I mean, coincidentally, we just had a call before this call with a video consultation provider, and it is something we do consider to be integrated into our system, but which is not currently done.
Awesome to hear. Cool. Apologies to our listeners. I think we're having some slight issues with the audio. Hopefully that should catch up and things. I guess another question we had was, what effectively would you say is the drop-off rate for when patients are using it? So obviously patients have to go through a process of inputting information. Have you got any idea of the kind of the number of patients that may not, may start the process but don't complete the information?
I don't have that right now, and don't know to what extent our system does provide that insight. What we do know is, let's say, that the pickup of the adoption by patients has been quite successful. The most important feedback we got from a customer that had until they used our system, 1% of their patients using the online platform that they had until that moment, and within a month of using our system, that was up to 25%. and they have exceeded to above 50%. So that's what I can give from a success perspective. The drop-off rate I would need to confirm still then.
Okay. Apologies, Christian. We seem to be having a few issues with the audio. I may bring Ben on if that's all right. I think just to see what may be causing the problems with your audio stream, to answer some of the questions in the meantime. So Ben has been in the chat for many of you. Ben, you're right there. Just added you onto the stream and stuff.
Yeah, I'm here. Can you hear me?
Yeah, we can hear you all right.
Hear you. Brilliant.
So I guess we've had some other questions as well coming through.
Yeah,
so one of the questions we've had is how, and I'll put it onto the screen. So so we've had a question from Yi Lim. How do you get around the consent issues, i.e. parents submitting on children's behalf or for carers of vulnerable patients, that kind of thing?
Yeah, I was just busily typing away answering that question. So we have a proxy setting. So carers, parents, guardians, etc., can submit or in care homes as well. We have cases where the system's been used in care homes to submit inquiries to the GPs. When before the inquiry is submitted, we have the option of the person. It can be submitted by a proxy, essentially. So the proxy has to identify themselves as the person submitting the inquiry on behalf of the patient.
Okay. Sorry,
there's a bit of delay on the line.
Again, the audio doesn't seem to be great, and I apologise for this EGP. I'm not quite sure. Yeah. We'll see if we can get back to Christian on that one. Christian, do you mind answering the question again for us, if that's okay?
Yeah, sorry. I did hear
Christian,
you.
Are you there?
Yeah, I heard you and Ben perfect. There is a delay, but the sound is good. So yeah, so basically what Ben said is that we provide an option for a proxy to fill in for someone else. They have to identify themselves and they tick a box so they can submit an appointment request or a medical inquiry for someone else. Do you hear me?
Really do apologise, EPChillers. I'm not quite sure why we're having so much issues with the audio from Ben and Christian. It seems to be quite patchy. We'll try and continue. I appreciate that may not have come through as well. And let me just see if there's some things I can do from our end to try and improve that. I guess the next question that we had was about the kind of support that we offer to the have-nots, and I guess some of that comes into the consent question. More specifically, I guess, can you explain a bit more detail about how you support practices? I know you talked about the induction process in your demonstration, but what additional support do you offer for practices as they use the system? Yeah,
so first of all, we assign a customer success manager to a new customer who manages the setup of the system. This customer success manager will remain the account manager for this customer, and who will then have periodical reviews with our customer. And so she is responsible for the setup, but also for any follow-up questions. And when it in respect to the setup and the launch, that's where we provide also marketing material and support to engage with the patients to support a successful adaptation by the patients of the system.
Okay, so that customer support person can obviously help the practice from there. Do you offer any patient support media to help patients with, I guess, using the system that the practice can share with patients, that kind of thing?
Yeah, so we do have different ways of informing. We have a video material, instruction videos for patients. We do have infographics. We also have, in the days when patients still went to the practice, we provided a roll-up which could be set up in the practice. And folders that a practice could share with their patients.
Thank you. And I guess next question I had is, from your perspective, I guess, what makes Klinik different to all the other platforms out there?
Well, I mean, the customers, we listen to our customers and what they feel makes us different. So as said, the user experience is one that's really important, both from the patient perspective as from the practice perspective. And with that, the intuitive use of the symptom cloud really helps that patients do go online and use the system to provide their medical inquiry online. Then the medical algorithm that we use in itself, there's only a limited amount of suppliers of patient flow management solutions that use a medical algorithm. And thirdly, the fact that we provide a complete patient flow management solution. So it's the practice gets the inquiry, but also we provide the tools then for the practice to process an incoming inquiry more efficiently than they would have with alternative solutions.
Okay. So what I'm just going to do briefly, just to see if we can improve the audio for everybody, I'm just going to ask Christian to pop out and log back in. And whilst we do that, I'm just going to bring on our opportunity for you to leave some feedback for Klinik in terms of what they're doing and how the platform looks and stuff. So if you are watching this, if you go to either this web link or if you hold your camera up to the image in the top corner there, then that'll take you to a form that allows you to leave feedback and stuff, and hopefully that will give us some idea of what you think of this presentation, but also in terms of the feedback, the Klinik platform. I'm hoping we've got slightly better audio with Christian this time. Let's bring him back on. Are you there, Christian? Okay, we'll just give him a little bit longer to catch up. And in the meantime, what I will mention it as well is that we do have various other plans for all you GP learners, just before we get to the final couple of questions that we had for Klinik. So that's in addition to obviously the weekly webinars that we're doing here for looking at various different platforms and stuff. We also have our digital primary care conference, which is at the end of September, on the 30th of September, where you'll be able to engage with various different companies similar to Klinik and things, but also have the opportunity to hear from Dr. Nikki Kanani, Head of Director of Primary Care, as well as Dr. Minal Bakai, Head of Digital First Primary Care, and various others as they talk about what general practice is looking like in the future. This is an online conference, so no fears about Corona, and we will have various content and things that you're welcome to engage with, and if you wanted to look at that, there's the web link to do so. And in addition, we're running a challenge to help people with things like remote consultations, so particularly online, telephone, and video consultations, that starts on the 7th of September. And this is a free challenge that you can join, so particularly if you've got difficulties with doing online consultations, similar to, I guess, what Klinik have shown in terms of demand, how to do those actual consultations. We'll be running a series with myself and Dr. Ed Pooley of 10 Minute Medicine, where we'll be showing you daily how to improve, hopefully, how that works for you. It's completely free. Just have to sign up through that link there, and that starts on the 7th of September, so do sign up beforehand. I'm going to bring Christian back on. How are we doing, Christian?
I hope better, but
fingers crossed that's looking a bit better.
Is it better?
Yep, seems to be a little bit better. A tiny bit, yeah. Unfortunately, we still seem to be having some issues, and I really do apologize to everybody for this. I'm not quite sure why. We talked about the AI platform, I guess, and we had some comments from our our viewers as well. In terms of the AI system itself, how exactly does that work? Is it, is it up to NICE standards? Can you give us a bit more detail about how the AI element works? I think Ben's put some comments already, but it'd be nice to hear it on the stream as well.
Yes. Yeah. So, well, as said, we work with symptom clouds, which is built up with focusing on primary symptoms, and then narrows down on more specific symptoms, and in the third place has a third cloud that looks at the urgency. It's as I said, recognizes over 1,000 different symptoms. It also considers mental health issues, and in terms of its performance, we use the feedback loop that we then use to validate the suggestions made by our system.
Cool. And as I put on screen, Ben's comments about the algorithm and how it's CE marked and validated by healthcare professionals for over 4 years, and it's got 0 high security issues and stuff in terms of how it's working. I guess one of the common questions we get for any kind of platform like this is effectively, can you give us an idea of the cost of the platform itself?
Yeah, so our, let's say, off-the-shelf cost for a single practice usage would be 50p per patient per year, plus £100 maintenance fee per month, plus a setup fee of £950, which is one-off.
Okay, so £950 setup, £100 per month maintenance, and approximately 50p per patient per year.
Yes.
Is that correct?
Yeah, that's correct.
Okay. And I guess in terms of return on investment, have you any information as to how practices have seen that change, I guess, their demand in terms of what they've had with patients coming through?
Yes, well, I mean, clearly there has been a clear efficiency benefit in having an identification of all the incoming inquiries which are suitable for self-care or non-urgent, which either can be straight away communicated back to the patient or can be dealt with by the care navigation team. So that took away already quite a lot of work and pressure from the GPs. Secondly, what was an interesting feedback is that the Connect module, which a telephone team can use to triage, has really shown as a great benefit that it increased the quality of triaging done by the care navigation team. And we also have a Finnish study that where it shows the cost reduction if Klinik was introduced as the first point of contact, which is a case study that can be requested via our website, and that we can and maybe Ben can put a link on the chat, but then people can download that case study which shows the savings.
Cool. Happy to take any further questions if you've got any from the people watching, but in the meantime, whilst we wait for that, I guess, what is in the future for Klinik then, in terms of, what are the plans for Klinik moving forward? Yeah,
so the product roadmap, as it looks at the moment, let's say the highest priority for us is first to get the integration with EMIS and System 1, which then also integrates the text messages with EMIS and System 1. And then the second one is the possibility for the patient to upload files and pictures. Thirdly, what we are looking at is the self-care indication, so that we provide a module that provides the feedback that symptoms are suitable for self-care directly to the patient with suggestions where to go. And the last one that I also mentioned is the integration with the NHS app. So those are the, let's say, the 4 on the agenda for this year. For next year, as said, video consultation is clearly also on our radar.
Sure. And I guess particularly that integration with the NHS app will make a lot of assurances in terms of security, with obviously the NHS app sign-on process being pretty secure, and potentially also allowing things like proxy access and that kind of thing as well.
Yeah.
We've had another question from Yi Lim, so I'm going to put that on the screen. So your Facebook page quotes an impressive potential savings of about £200,000 per year for an average practice. Do you have any data in the public domain or case studies to support this?
Well, we've got one case study, which is the one done in Finland. The 200K per year savings is a link to one of our partners that we work with, which is a consultancy firm that uses our system and suggests to practice a whole system triage approach. And based on their modeling, using our system and their recommendation, they came to a potential saving of 200K. So that's specifically linked to their whole system triage point. So when it comes specifically to the savings of what we have shown in our with the use of our system, I would have to refer to the Finnish case study that's made available via our website.
Okay. I guess potentially as time goes on, you will have more information for those kind of savings, with obviously practices uptaking the system here in the UK, and obviously the impact that will hopefully have moving forward, I guess.
Yes.
Awesome. So thank you, Christian, for that. I know that many of our EGP learners hopefully have enjoyed this session and had the opportunity to obviously ask their questions and everything else. Apologies again, EGP learners. I'm not quite sure what happened to the audio during part way through. It seems to have improved magically, and I'm glad for that. I know Ben's been answering questions in the meantime in the chat, so there are further details there. Obviously, Klinik are more than happy to answer your questions if you contact them directly. I'm guessing that's through the website. Is that the best way, Christian?
Yes. Please submit a demo request via our website, and you get me again via Microsoft Teams or any other solution that you prefer.
Awesome. And again, if you are watching us live, or if you're watching this after the effect as well, please feel free to fill in our feedback questionnaire. Really appreciate if you could do that and give us more information as to both this type of session and what you think. We have, as I said, got similar kind of demonstrations, things planned in the future, and lots of information in terms of future events for you as well from EGP Learning. And as always, EGP Learning is here to save you and your patients time by taking ads in your primary care and learning. And we'll catch you in the next episode.
Thank you.